Hepatitis C, what you need to know. What is hepatitis C? Hepatitis C is a disease that affects the liver. Normally it doesn't have any symptoms, and it is passed through bodily fluids. How is it spread? There are several ways you can get Hep C. Through contact with the blood of someone who has hepatitis C, birth, when a mother with hepatitis C gives it to her child, having sex with someone who has hepatitis C, being stuck with dirty needles that have been used by someone with hepatitis C, using an affected person's razor or toothbrush, sharing needles with someone who has hepatitis C. What are the symptoms? Even though you might not exhibit any symptoms, here are some signs to look out for. Yellowish skin or eyes, easy bruising, tiredness, upset stomach, fever, loss of hunger, diarrhea, light-colored poop, dark-colored pee. How can I prevent this? There are many ways to prevent getting Hep C. 1. Avoid sharing needles, works, cottons, ties, spoons, etc. Secondly, you decide to get a tattoo or a piercing, make sure you find a trustworthy shop. And lastly, if you are sexually active, make sure you use a condom, even if you will only have sex with one person. How do I get tested? First, check with your primary care physician. If you do not have a primary care physician, check out these clinics for testing. Bread for the City, Family Medical and Counseling Services. What do I do if the test is positive? First, you should know that it takes some time for the test to test positive. But here are the following exams you should take. An antibody test, which is a simple blood test that can tell if you've ever been exposed to hepatitis C. You should also know that 2 out of 10 people who have been exposed have been able to fight off the virus without treatment. There's also the viral load test. Once you test positive for antibody test, your doctor knows you have been exposed to hepatitis C, and a secondary test can tell if you still have hepatitis C. And lastly, liver tissue testing may be required. This is when a doctor sticks a thin needle into your liver to take tissue samples. This test can determine how much of the virus has affected your body. Lastly, here are some resources you might want to check out.